Okay, so welcome everybody. Sarah Munro here again. So this is week 6 of our open staff dial-in. So a huge thank you. I know as I always put the screen up, I can see some familiar faces that are joining each week. So thank you very much. I do appreciate people finding the time. Apologies, we have made the time slightly different this week just to accommodate some other things that had gone into my diary. But we are trying to stick to the same time each week so it's consistent for other people. So the usual format is going to be 30 minutes of me taking you through some important updates and information. We've got one question that's come in the past week that we'll answer at the end, that's in the slides. And if you've got any other questions, any other comments, please use the corona.virus@nhs.net inbox. We've had some other feedback this week in terms of the comms, which people are finding helpful. So all of us have been sharing that with the team. Try and keep everybody else on mute if we can, so that it just makes it easier for everybody else to hear and follow what we're discussing. Okay, so again, I always like to start with a huge thank you. A week at the moment feels like an absolute lifetime with the amount of work that everybody's doing, the pace at which everybody's working, and the fact that there's just so much happening in such a short space of time. More people in the past week have moved into different teams, taken on additional roles and tasks, and thank you for the feedback that you're giving. And I know some of that's been shared on social media. I am reiterating, I've said the same to the team today on the daily sit rep. This is about sustaining ourselves, so make sure that you're finding time. I know there's not a huge amount you can do outside of work, but hopefully you're finding time for some rest and recuperation. And look at this fantastic cake. So the Ward 4 staff received this over at the Mount this week from one of the staff nurses' friends. So a huge thank you, and I'm sure many of you on the call will join me each week as we do on a Thursday evening out, saying thank you to one another and all of our frontline colleagues, not just in health and care, but across our frontline services as well. So I just wanted to start with some reflections over the last week, because it does feel as though quite a lot has happened. Thank you. We had a huge number of people join the call yesterday for the service that took place with our own trust chaplain, Father Michael, and that was about paying tribute to Cooley. It was part of a national minute silence, but also service users that we've sadly lost in the past few weeks. One of our service users in supported living, which Graham Firth talks so passionately about, and we have lost 2 service users who were being cared for at the Mount. And one of the, hopefully you'll have seen the daily comms that we've been sending out that went out yesterday. So one of the gentlemen that died at the Mount, his wife sent in the most amazing feedback for the nursing staff and all the multidisciplinary team on the ward, just showing a huge appreciation for the care that they provided and what a difference it made to her at such a significant point in her life and her family's life. So a huge thank you to our staff over at the Mount. And you'll have seen some of the footage last week with the Thursday night clap that the police came and gave joined in their thanks, especially at the Newsom and the Becklin Centre alongside of our staff. I've mentioned the choir again, so we showed this for the first time last week, and you may have seen again through our daily updates that's now been shared in other countries around the world, in Europe and as far afield as Australia. And yesterday we were contacted by BBC Look North to ask if they could speak to some of the members of the choir, look to profiling that on the news later this week. So watch this space. I'm not sure the choir, when they first came together, had some lofty ambitions of wanting to be on the regional news, but there you go. It certainly made a difference to us, and no doubt it's great to share that much further afield. So a huge thank you to the choir. And again, just to update, we've had more staff being redeployed across the trust to support some of our priority services where we have had staff that have been going off poorly, that have got COVID. And we're seeing that kind of plateau out at the moment with those rates of staff that are currently not at work, and those are the staff that we're just tracking and making sure that they're getting daily or regular updates to keep in touch with them and see any additional support that people need. We've now seen the launch of our Ward Olympics on Monday, thanks to our OT staff across our inpatient services. So keep those of you on Twitter, keep looking out for the updates from all the different activities that have taken place. Some fantastic flags have been produced, so a huge amount of creativity going on. And just a reminder, we are changing the way now that we've reported the results for staff and for service users that are positive and negative, because it is quite a changing picture with people newly diagnosed as positive, but then people that are now recovering from coronavirus, once they come out of isolation at the end of each week, we'll be able to give you a more accurate update of all of those figures, because increasingly now more and more people are recovering. And certainly today we've had no patients needed to be tested because of them being symptomatic, but I'm going to talk about testing a little bit more in a moment. So just some updates on the regional, the national and the local news, although I suppose the latest national news is our Prime Minister is now a father again, if you've seen that pop up on your news feeds this morning. But in more pertinent news in terms of coronavirus, we are really clear we're going to be living with coronavirus in society and in our services, therefore, for quite a number of months to come. I did mention this a bit last week. We have now just received a letter from Simon Stevens setting out how at a national level they want to take forward the ongoing support and management of services across the health and care sector. So what we really need to consider is, what does it mean to our services to continue to provide the mental health and learning disability support that people need, but manage and minimise the risk presented by COVID on an ongoing basis, recognising that it's going to be a feature within our clinical services. And that's where our infection prevention control procedures are really important. You'll have also seen from the news that there is plans being developed to scale up contact tracing capacity. So at the moment that's being led nationally, but at a Leeds level, we're having conversations to say, what can we put in place locally to make sure it works better for us than one standard model. So those are active conversations taking place. Just a reminder, again, you'll have seen we included this in our comms last week. Ramadan is now underway, and that's a huge amount, means a huge amount for some of our colleagues and our service users. But there are additional challenges because of COVID to make sure that people that are celebrating Ramadan are able to do so safe and well. So if you've got any questions or concerns, just follow the links into our Trust website, and there's the most up-to-date guidance that we've got on there for you to have a look at. PPE continues to be a huge focal point in the news, nationally, regionally, and in our local news too. So I just want to remind and reassure all of our staff, we have got adequate stocks of all the protective equipment that our staff need for all of the activities that we undertake within our services. Robust stock management arrangements are in place. So not only do we have stores local at 12 sites across the Trust for clinical staff to access directly, we still have our central stores. Our stores are operating 7 days a week in order to receive deliveries and make sure that they are supplying out to our frontline services as well. So we've got no shortage of giving you the equipment that you do need to keep you safe. And last week we did pick up some questions and queries that not everybody fully understood some of the guidance that had most recently been issued. So you may have seen Nicholas Anderson did a live webinar for people to join in yesterday just to talk people through the guidance again on PPE. And all of this is as up to date as possible on our website. So any queries, just go onto the website or get in contact with the physical health team if you want some additional information for your service. So one area I wanted to talk again specifically about, which we've referenced a couple of times in the past couple of weeks, at a national level, when you look at the impact of COVID on BAME communities, there does appear to be a disproportionate impact. So more people are adversely affected in BAME communities than non-BAME communities from COVID-19. So there's work taking place nationally in relation to what that's about and trying to understand the causes of that. And that there's a series of webinars and there's a number of working groups now being stood up, which is around staff support, what we do in terms of support of service users, how do we make sure that we're having open, inclusive conversations, and how do we properly assess at an individual level people that are at increased risk. And a lot of those risks comes from having other pre-existing health conditions. So it's really important that you have an individual conversation if you are affected in relation to your own risks and what we can do to put the right support in place to keep you safe. And just so you know, again, I've mentioned this, Claire Holmes, our Director of OD and Workforce, Wendy Tangent, who's the chair of our RED network, are now establishing with Caroline Bamford a specific task group as part of our Equality and Inclusion Committee looking at the impact of COVID from a BME point of view for our colleagues and our service users and what more we need to do. Wendy's arranged an additional meeting with the Race Equality Network, and that's taking place tomorrow. So please do use your existing networks of contact and give us the feedback. I've had a few emails this week from colleagues in the Trust giving some feedback, and I've shared them and any additional information that we get with Claire and with Wendy. We just need to keep this part of our ongoing conversation to make sure that colleagues are feeling as supported as we possibly can do. So I just wanted to talk a little bit about testing, because there's been quite a lot happening, not just what you've seen in the national news, but locally. The first thing I'll say is you'll see the national line was set up for key workers to access testing, and that was presented with some challenges with the national line crashing very quickly and the web access. For our staff, where possible, we want you to continue to use the routes that we've got in place with local testing through the HR team in order to get testing either through Temple Green at the moment or through LTHT, which is our local lab. We were asked if we would take part in a pilot this week to test 250 combination of service users and staff for COVID that didn't have any symptoms. So a huge thank you, because this was mobilised at very short notice, and a lot of extra hours were put in the last 24, 36 hours by the physical health team in particular to put this swabbing in place. So we've used up all of our swabs now for staff and for service users, roughly 2/3 staff and 1/3 service users. I have to say the demand for the swabs and the test outstripped the capacity that we had to do it. But what we're hoping is, by taking part in that pilot, that's going to inform the next approach to whole screening, particularly in the NHS and the social care sector. So the information that brings back will be really useful of influencing the approach that we've got to routine swabbing, not just for those that have got symptoms. So thank you. Apologies to those that will be disappointed that we didn't have enough capacity to everybody that came forward, but we'll keep you updated with what the outcomes of that trial are. If you or a family member are showing any symptoms, the approach to testing is there and it's still available. So please do contact HR and we can get you booked in for a test in Leeds in the same way that we have been doing for the past couple of weeks. So I just wanted to talk a little bit about looking ahead. We had a Gold Command meeting as part of our incident structure this morning, where we've been taking stock of all the work that we've done so far and being able then to look ahead of what's it going to look like for our services. So the phrase we're using is we're going to be living within the context of a chronic pandemic, and we know that's challenging for all of us. It'll continue to alter the way that we live both our professional lives at work and our personal lives at home. But we're all in this together. We're all facing the same challenges and trying to make sense of the best way forward. So we really need to consider what the impact of this is going to be in terms of mental health for ourselves and our communities and the populations that we provide services to. So the three areas that we're having a conversation about in terms of predicting future demand: those people that we already provide services to under our mental health and our learning disability services, what's the impact of COVID going to be on them? So we know that we've already seen a reduction in referrals to some of our services. Does that mean that we're going to have a bigger demand from those same people a little bit later on when we move into the next phase of lifting those social restrictions? Then there's all those people that have never had contact with mental health services before, and because of things like the economic impact, we're going to see an increased need for people needing mental health support. So what does that start to look like, and how do we meet the needs of those people? And then the third group to think about is health and care staff that have had the added stress of providing health and care to people experiencing COVID and managing those demands. How do we make sure that we're meeting the mental health support needs of those in the long term? So that's being looked at nationally, and we're also looking at what that means for locally. Not got the answers now. These are active conversations that are taking place. And then it's thinking about, well, how do we continue to organise ourselves in the best possible way to meet that demand, as well as keeping all of our staff safe from the ongoing risk of infection and our service users safe from the ongoing risk of infection. So this will start to inform our planning in the coming weeks, learning from what we've already put in place in the past 4 to 6 weeks. And at the forefront of all of this is in effect, making sure that we adhere to our infection prevention and control policies and procedures, which are extremely clear. They are consistent across every NHS organisation in the country, and we need to stick to those to follow through. So they're all available on the website. If people just need to refresh themselves, just go back to our standard IPC policies and procedures to support us in managing the risk of infection. And I suppose the final point to say in looking ahead is, if you think about how the last few weeks has felt, we've changed a huge amount. The way we were operating last week is not the same as how we were operating the week before. This week we're operating differently again because of the changes in testing capacity and the impact on workforce. So the biggest principle that needs to run through our plans for the next few months and even into 2021 is the ability to be flexible and adapt and change what we're doing in response to the changing context around us. Everybody's done a huge job, a fantastic job of doing this well so far, but we need to make sure that we maintain that flexibility. That of course puts extra demands on us individually, which is why I always reiterate the importance of using your time away from work for your rest, your breaks, doing something which is you find beneficial and restorative to keep everybody's own health and well-being as good as it can be. So last week I said anybody who wants to get their photos shown for some of the fantastic work that's going on across the Trust. So here's some of the latest submissions that we've had. We've now launched the Letters to Loved One campaign, so that people that aren't able to come and visit can go through the patient experience team, and they'll be making sure that letters and messages can get through to service users that don't have other means of being able to contact their family and friends. There's one of the posters that's been done. I think that one's over at Clifton House as part of the Ward Olympics week. I think I've got the right unit. I'm sure they'll tell me if I've not. And the wobble room that's now up and running at the perinatal service. So, the pictures can speak 1,000 words, can't they? And it's actually great to be able to just see what else is going on across the organisation when you're not able to visit in person. So if you want to be on our gallery next week of reasons to be proud, then please just send your pictures in either to me, through Twitter, or to the communications team. So let's have a look at the questions that we've got. I know we've got one already that we had from last week. So why do staff have to ring HR first to book a test? Because the way that the system has been set up, the Temple Green site is not there for open access. The slots have to be booked by your employer first, because otherwise the concern was members of the general public would go and be able and use slots that actually need to be protected and ring fenced for frontline healthcare workers. So no, you can't just drop in with ID. It needs to be booked in advance in order to access those tests. I'll have a quick look now at what we've got on the chat. What about staff that are shielding? Does this mean months before returning to sites? Tricia, so at the moment, the shielding guidance that's been put in place is we need to stick to. So that was for up to 3 months for people that were in high risk categories. And at the moment, there is no guidance issued. We've all got, family and friends also affected by the shielding guidance, is that whilst there remains that risk of being able to contract COVID, at the moment, the most important thing you can do, unfortunately, I know it's difficult, is to be in that shielding category and keep yourself safe and minimise any social contact. I know that's tough, but I'm hoping that there'll be some other guidance, especially with the rollout of testing, and whether that means that we can start to think differently about that shielding category. We've got a thanks there to Nicola and Stan on the PPE, so that's going to be included in the all staff email. So if you missed that yesterday, look out for the email that's coming out to everybody. Ruth, the waiting times for testing is the 17th of May. That's not the testing that we can access, Ruth. So that's my understanding is those dates are for people that are ringing up through the national system, not for our staff that we're being put forward, because obviously that's too much of a time gap for us. But I think somebody's already replied. Yeah, Claire Holmes has replied. Anybody got any questions or queries about staff testing, please just contact the HR team. It does get a bit confusing with all the different systems in place, which is why we're encouraging all of our staff to go through the trust arrangements, and then we can get you the access to the test as quickly as possible in the most convenient way possible as well. Right, I think that's it, isn't it? I don't think there's any more questions. I'll just have a quick look, see if anything else has popped up. No, okay. Right, thank you very much, everybody. I don't know what I've done with my screen now. Oh, there, I found you all again. The joys of technology. Right, thank you very much. And no doubt I shall see some of you again for week 7, which will be next week.